Acute rheumatic fever. This is a complication from an untreated Group A strep pharyngitis. So Group A strep, what is that? What's the other name for it? It's strep pyogenes, whatever you want to call it. So this Group A strep has a bacterial M protein, and our body will produce antibodies against that M protein. So we get struggling. We're going to make these antibodies against M protein. However, our antibodies that we make happen to cross-react with our own tissue. So they're going to attack our own tissue. So this occurs about 3 weeks after 3 weeks after your acute strep throat infection. Because it's 3 weeks because your body takes time to make that antibody and then has to go around attacking your own tissue. Now the question is, where do we see this? And in what parts of the world do we see this? That's the question. And the answer is in the developing countries. And the main reason why is because those people aren't getting treated for their Group A strep. In America, everybody's going to get a throat swab when you show up with a sore throat in the pediatric office. And then they get that strep throat swab and they get treated. But in the developing countries, it does not happen, so you develop acute rheumatic fever. Now, what are the symptoms of acute rheumatic fever? Remember, this is autoimmune process against all the tissues around the body. So the symptoms are going to be the Jones criteria. And if you can remember them, try to remember them now. Jones, J stands for joints. So this is a migrating polyarthritis. And what does that mean? Polyarthritis means multiple joints are affected, you get joint pain. And migrating means that it's going to affect one joint, and it's going to go away after a while, and then the inflammation is going to migrate to another joint, and you're going to get swelling and pain there. Now this heart stands for pancarditis. That means you have inflammation in each layer of the heart. Remember what the layers were? The layers were the endocardium, the myocardium, and the pericardium. So you can have endocarditis, myocarditis, and pericarditis. Now remember, the endocardium involves the valves as well. And what happens is your mitral valve is involved much more than your aortic valve. Those are the two main valves that are going to be involved in acute rheumatic fever. And mitral valve is involved a lot more. So I can remember two things with one. You remember the M protein, and mitral valve is involved the most. So early on, you start with mitral regurgitation, and then eventually you're going to get inflammation in that valve, and eventually it's going to so first your valve gets regurgitation. Eventually they're going to fibrose together. Let's draw that fibrosis out. They're going to fibrosis as they heal from the inflammation, and that's how you get mitral stenosis. All right, next is nodules, subcutaneous nodules, so little bumps under the skin. That's the N, and the E stands for erythema marginatum. That's a rash with a clearing center and an advancing edge. So you have a rash. Let's change it to red. You have a rash. Okay. The center is going to be clearing, and your edge is advancing, so it's spreading out that way. Erythema marginatum. Finally, syndrome chorea. That is involuntary random dancing movement. So you're just kind of like, your body's moving randomly, but it looks like you're dancing. So that's the Jones criteria. Those are the most common symptoms for acute rheumatic fever. And on histology, you're going to see a couple characteristic things. If you remember, think about it now. If not, I'm going to show you. It's Aschoff bodies, which is this. It's a granuloma with giant cells. This is our granuloma with giant cells inside. And then you have Anichkal cells. These are macrophages. And the key thing here is that their nuclei look like caterpillar, I don't know, whatever. So Aschoff bodies and Anichkal cells in acute rheumatic fever. Now, the acute disease usually resolves and you're fine, but unfortunately this can progress into chronic rheumatic heart disease, which we're going to talk about in a second. And the way we prevent this, as I already told you, we already know how to prevent this. The way you prevent it is you treat that strep pharyngitis early with a penicillin. Alright, so let's talk about chronic rheumatic fever now. This is scarring from the acute rheumatic fever, which we just talked about. Your mitral valves almost always scar, as you can see here, and you get that fish mouth appearance. It looks like a fish mouth. Actually, let me erase that so you can see it more clearly. Fish mouth appearance with mitral stenosis. So mitral stenosis is the key finding that you end up having. If you see a patient with mitral stenosis, it's almost always from rheumatic fever. Now your aortic valves can also scar, again due to inflammation and then subsequent fibrosis, but that is less common. But that will lead you with aortic stenosis. Alright, so that's it.